Good afternoon, students. Welcome in HCP lecture. Today I will start the lecture of Hospital and Clinical Pharmacy. Chapter number 8, that is Pharmacy and Therapeutics Committee. Now I will start the. Let us first shortly look at what we saw in previous lecture. First is introductory part of the chapter, that is the medical staff are responsible for the policies and practice of drug utilization within the hospital. Then these are carried out by the medical staff in cooperation with the pharmacist and representatives of other disciplines as required by forming a medical staff committee. This committee is pharmacy and therapeutic, that is P&T committee. Then composition of PTC. The Pharmacy and Therapeutic Committee is composed of representatives from all walk of healthcare system. Then P&T Committee. P&T Committee shows the physician, pharmacists, nurses, and administrators. In physicians, again classified general medicine, general surgeon, and anesthetics. Then a chairperson is appointed from physician's representative, and a pharmacist work as secretary. Then purpose of the PTC. The Pharmacy and Therapeutic Committee work with the two main objectives of purposes as below. First is educational and advisory. In educational, PTC recommends the organizing programs, seminars or workshop to furnish the current development on matters regarding drug and safe use. In advisory, PTC emphasis on implementation of policies laid down for selection, evaluation and rational use of the drug in hospital. Then next is agenda of the committee. In that, a typical agenda may consist of the following points, that is minutes of previous meeting and review of. Then hospital formulary section, either additions or deletion of product. Then adverse drug reaction reported in the hospital since the previous meeting, that is drug safety in the hospital. Then function and objectives of the P&T committee. First, to guide the medical staff and the hospital administrators in all manners related to the use of drugs. Then lay down written policies and procedures for the appraisal, selection, procurement, storage and distribution drugs. Then prepare a list of drugs to be kept in the World Pharmacy floor stock drug system. Then to prepare a list of drugs for emergency kit and first aid kit. Then to form a hospital own formulary, periodically update it. Then to review adverse drug reaction to the drugs. Then establish and promote the suitable educational programs on safe use of the drugs in the hospital for all professional staff members. Like that. Then PTC shows the medical staff and pharmacy staff. Then in PTC, subcommittee for gastrointestinal tract, then subcommittee for cardiovascular disorders, then subcommittee for the endocrinology, then subcommittee for antibiotics and chemotherapeutics, then subcommittee for CNS agents, then subcommittee for maternity and pediatrics, then subcommittee for chest diseases. Okay. Then next point of this chapter is PTC and adverse drug reactions. In that, sometimes the drugs may produce unwanted or unexpected effect. This is called as the adverse drug reaction. It is a result of overdosage, hypersensitivity or allergic condition. The committee acts in the two ways, that is to treat such patients and to prevent the such happening in the future. A physician concerned with submit a report for this. The typical format of ADR is as follows. Okay. What is the PTC and adverse drug reaction? In that, sometimes the drugs may produce the unwanted or unexpected effect. It is called as the adverse drug reaction. Then this committee act in two ways, that is to treat the such patient and to prevent the such happening in the future. Okay. Now these are the adverse drug reaction report. In that, first is report number, then date, name of patient, age, in year, then gender, body weight in kilogram, then therapy followed. First is reported disease or indications, then drug that produce ADR, then reaction details, then source of drugs, in that first batch number, MFG and expiry date, manufacturing expiry date, then manufacturer, then step taken to treat ADR, adverse drug reaction, then name of attending physicians, then signature of the physician. These are the adverse drug reaction report. Then next is significance. In that, first is drug selection, second drug safety, third adverse drug reaction, fourth drug product defect reporting program, then development of emergency drug list and drug utilization review, that is DUR. Okay, now I will start. The first is drug selection. In that, the drug to be used in the hospital are evaluated and approved by the P&T committee. These drugs are categorized as, first is formulary drug, which are FDA approved drugs and recommended as being essential for good patient care, and these may be prescribed by the all attending staff and resident. Then next is conditionally approved drugs are the drugs which are approved by the FDA for general use, but which the committee will evaluate for 6 or 12 months before final consideration. Then next is investigational drugs are the drug which approved by the FDA for specific use by the sponsor and designated associates. Such drugs are not commercially available. Then non-formulary drugs are the drugs which are not categorized in the above 4 categories. Okay. Then next is drug safety, and that in order to ascertain safety, P&T committee has to ensure that the safe working space, then facilities and equipment are provided in the pharmacy. The committee also reviews safety aspects in the policies regarding automatic stop orders for dangerous drugs, research quality control standard for the medications, etc. Then the distribution and storage of the drugs at nursing stations, reference on safe use of the drugs available at the hospital library are also considered by the P&T committee. Then next is adverse drug reaction. In that, P&T committee has to develop the procedure so that the adverse reactions are reported promptly. The committee generally prepares adverse drug reaction form which are made available at every nursing station. The attending physicians complete the form and reports to the clinical pharmacologist or the chairman of P&T committee. Then next is drug product defect reporting program. In that, in USA, United States Pharmacopoeia, that is USP, then Food and Drug Administration, that is FDA, and American Society of Hospital Pharmacists, that is ASHP. Okay, then these have started program. Then the format of reporting the drugs defect are provided to the hospital pharmacies. Then includes the information regarding dosage forms such as name, strength, lot numbers, date of manufacture, etc. Then information of suppliers and manufacturer name, the name of the reporting hospitals and pharmacist, and the drug defects. The drug defects like inadequate labels, then deteriorated or defective products, then inadequate package, etc. This information has to be forwarded to USP and FDA. Then these all are about the drug product defect reporting program. Okay, then next point is development of emergency drug list. In that, the Pharmacy and Therapeutic Committee develops the list of drugs which should be present in the emergency or state boxes. Okay, as per this list of emergency boxes are prepared and kept in the suitable places. Then these are the development of emergency drug list. Then last is drug utilization review, that is DUR. In that, drug utilization review is defined as an authorized, structured, and continuing program that reviews, analyzes, and interprets pattern of drug uses in the given healthcare delivery system against the predetermined standards. It is necessary to review the drug therapy to identify its deficiencies and develop strategies to correct them. This can be achieved by drug utilization review. Okay, these are the drug utilization review, that is DUR. Okay, here are completed the chapter of pharmacy and therapeutic committee. Okay, I will revise this point again. PTC and adverse drug reaction. In PTC and adverse drug reaction, sometimes the drugs may produce the unwanted and unpredicted, is also called as adverse drug reaction. Then these are the adverse drug reaction report. Okay, then significance. In significance, first is drug selection, drug safety, then third is adverse drug reaction, then drug product defect reporting program, then development of emergency drug list, and last is drug utilization report, that is DUR. Okay, and these are the important questions of this chapter. It is most important in point of view exam. Okay, so after watching this video, you all students are able to answer this question. Okay, now I will stop here. Thank you.